So welcome back. We're now going to transition. We have 2 lightning presentations today. Each presentation will be about 5 to 7 minutes with a few minutes for Q&A. Our first lightning presenter is Alec Calac. He is an MD, PhD candidate at UC San Diego, passionate about Indigenous health equity and advocating for a more just future for tribal communities. His research leverages data-driven technologies to generate insights into long-standing Native American health disparities. Please join me in welcoming Alec to the stage.
Maybe. Okay. Let's see here. Well, thank you so much for the introduction. Miu Yam and the Tong Alec Calac Yaka, known the Tauf Pamangai. My name is Alec, and I'm a member of the Pauma band of Luiseño Indians. I'm very excited to be here at UCLA and really take some time away from writing my dissertation to do something that's equally stressful, if not more. There are more people in this room than there are members of my own tribal community alive. And when I think back to the history of the state of California, it's really lucky that I'm here today because California once sought to exterminate the Indian problem rather than see us as Indian people. And even today, we face a genocide in medicine and public health, or what's referred to as a data genocide, wherein the CDC estimates that 40% of American Indian and Alaska Natives are misclassified as non-Hispanic white on their death certificates. So when we think about Native American health disparities being where they are today as some of the worst in the country, even those figures are undercounts. So when I think about my own community, Pauma, this translates to the place where there is water. And no matter how we carry the water or how much we carry, our people have always dedicated ourselves to the betterment of tribal communities, not just our own, but to all of our relations around us. When thinking about data, the title of my presentation is An Indigenous Perspective on Big Data and Emerging Technologies. I don't see data as an asset, a resource, something with inherent value, but really data as a relation, an extension of ourselves. And in thinking about how Indigenous peoples have been responsible stewards of our languages, our cultures, our traditions since time immemorial, shouldn't we also be responsible stewards of the data that comes from our communities? But unfortunately, there's a long history of exploiting and taking data away from our communities without any benefit returned to us. So in being a student for a university system that continues to not return the remains of our ancestors from California Indian tribes, it's a very tough difficulty to balance being a student as well as a community member that has such a kind of tortuous history with the state of California. So as an MD PhD candidate and thinking about insights into health, there are many dimensions of health, right? Modern medical practice would teach us that health is simply the absence of disease. But for Indigenous peoples, as well as many ethnic communities, we can think about health as an interplay between so many different domains, whether they be physical, mental, social, and spiritual, and thinking about how one is not more important than the other, but to think about all of them equally and pay attention to the specific needs of those communities. We also have different ways of evaluating our health. Western methods, statistical analyses, p-values. We also have Indigenous means of evaluation, those observed directly from experience. So when we think about data, data is not just what comes from spreadsheets and analytical methods. Data is also experience. And Indigenous peoples have observed the world and environment around us since time immemorial, and we have generated unique insights into what goes into evaluating our health. So in thinking about the different levels of health and the determinants of health, ranging from the individual to the more societal and structural determinants of health, we can think about how we can apply one system of knowledge, but also think about how we can apply both at the same time and also bring that perspective into a profession that historically has disregarded Indigenous knowledge, But unfortunately, we know that this knowledge is unquestionably needed as we work to advance health equity for all populations. So in thinking about data as a relation, we also know that there are many kinds of data, whether social media, economic, genetic, health, and there are different ways that we can approach data. From an Indigenous perspective, we can think about the 4 R's, our respect for data, its relevance, reciprocity, responsibility, but these aren't always in the kind of social consciousness of researchers that are conducting research often on Indigenous communities rather than with Indigenous communities. And thinking about other ways of evaluating, oh, I think I skipped one slide, there we go. From a more technical perspective and in thinking about data-driven technologies, researchers often think about it from a more methodical standpoint, whether data is findable, accessible, interoperable, reusable. But I'd ask, what is the utility of these principles when agencies like the Indian Health Service, the federal agency providing healthcare to American Indians and Alaskan Natives, uses an electronic health record that is not interoperable, and that will also be obsolete within the next 5 years, and was designed in the 1970s. So I'm thinking about the resources that we give to Indigenous peoples to address their healthcare needs, it's clearly inadequate. So what if we flipped this and thought about it from a more Indigenous perspective, and thinking about data truly as a relation and something that we are responsible for? What is the collective benefit of the data that we generate? Who has the authority to control data? How can tribal governments exercise their sovereignty over the collection, management, and access of data that comes from their own members? Who has a responsibility to steward that data and make sure that it's used in a responsible way? And also ethics. How can we think about not just minimizing harm to the individual, but minimizing risk to the community? So in closing, this presentation wasn't meant to be your sole answer to everything as it relates to Indigenous communities, but rather to challenge you to unlearn what you know about Indigenous peoples and start asking questions about how we typically conduct research with them and think about how we can better our own research moving forward. Thank you.
Thank you so much, Alec, for the presentation. So we do have a couple minutes for a little bit of discussion, and I believe our director, Madhavi, has a couple questions for Alec, so I'll hand it over to you.
Thank you so much, Alec. So I was thinking a little bit about one of the very important responses is, of course, bringing in more Indigenous colleagues into the environment. Tell me a little bit about the unlearning and what resources we might be able to access or use to really think about how we as researchers and scientists think about data.
Mm-hmm. That's a great question. I think when we consider working with data, it's not just what we learn from textbooks, but what we learn from our colleagues who come from these communities. Unfortunately, less than 0.5% of American Indians and Alaskan Natives hold a doctoral degree, and a similar proportion also hold a medical degree. So when we think about the likelihood of having representation in rooms like this, it can be very difficult. But as was said by our last speaker, it's not just looking to healthcare professionals or those who hold advanced degrees, but also thinking about community members who have that knowledge, but not necessarily the access to these institutions, and putting equal value on what they have to share, because often this is rooted in generations of Indigenous knowledge.
Thank you. I do have one other question, which relates to kind of the relationship building portion. I think Rohan reminded us of the need for apology and repair, and also the time it takes to build relationships and trust. And one of the things I think as part of the Institute is developing these relationships independent of a specific research project, and really thinking about long-standing relationships feels really important. What, in your experience, you kind of being in both spaces, in both worlds at the same time, what are some important areas that we should think about in terms of responding to the requests and needs of the, let's say, the community you're from, instead of thinking about our research agenda as a starting point?
I think the University of California Native American Opportunity Plan goes a long way in terms of increasing access to the UC system for students from these backgrounds to do the work that they wish to do and define impact the way that they wish to define impact. As you pointed out, it's always not just about research, it's also about health behavior, health promotion, public health, infrastructure, education, and really not tying things to the need to put something into a high impact journal, but acknowledging that if you can make a difference in a community, it doesn't have to be shared with the world because that's a very local context in which you're working in. There are more federally recognized tribes in the United States than there are people seated before me. So when we think about the needs of my community, that's very different than the needs of the communities that are also in San Diego County, of which there are 18 tribes just in San Diego County. In Arizona, there are around 21 or 22 federally recognized tribes. So geography is very different, and the needs of those communities are very different. So if you're only familiar with one tribe in your work, you're only familiar with one tribe.
Thank you so much.
Okay.